Well, joining me live now is Rimoin. She's a professor of epidemiology and director of the Center for Global Health Security at UCLA, University of California. Thank you very much for being with us. So, conflict, remote communities, aid budgets being slashed are some of the challenges being faced in containing this outbreak. You've been working in the DRC for nearly 25 years. Just talk us through how hard it is for doctors and workers on the ground right now.
This is a very, very complex situation that is, under the best of circumstances, logistically very, very difficult. You know, you're working in a place where without Ebola, you already have conflict. You already have a lot of lack of infrastructure. The lack of USAID funding now. Hospitals there, they rely on aid funding, and USAID was a major part of that network that kept things going at a very base level. So we're talking about a very complex situation that is very difficult for those doctors, those nurses, those healthcare workers, everybody on the ground right now to deal with and to get in front of a situation that is very, very serious. Yeah,
and on top of all that, you have misinformation and conspiracy theories. Why is there this distrust in healthcare?
Well, we've seen this kind of distrust in healthcare globally expand. So the DRC is like everywhere else in that sense, that if people aren't getting good information, they don't know who the trusted sources are, it becomes a lot of rumor, a lot of searching for information that isn't always there. And then on top of that, you have local belief systems. The educational system is very difficult, and always in conflict zones. And with lack of good communication on a regular basis, you deal with what you've got. So getting this trust of the community is going to be critical at this moment. And that means people have to be on the ground, and on the ground in a situation that is logistically complicated and dangerous at the same time. So a very difficult situation.
So what do you want to see happen at this point that's currently lacking?
Well, I think that global coordination and collaboration is going to be the key to everything, empowering the people that are on the ground that know how to get in front of it. DRC and Uganda have dealt with Ebola outbreaks before. They are experts. They do know how to deal with this kind of a situation, but we must give them the kind of aid that they need. We also need to be rapidly expanding expertise on the ground to be able to cover as much territory as possible and be able to improve diagnostics, to be able to allow people safe burials, allow people to have good care, and to really start tracking down all of these chains of transmission that have been going on for what we think now has been, at least more than a month. So very, very important to do this as quickly as possible.
Yeah, and the WHO is saying that they're playing catch up with the Ebola outbreak. This isn't the first Ebola outbreak. Why has this one been slow?
Well, the Bundibugyo strain of the Ebola virus is one that is not, the diagnostics that are used on the ground are usually targeted towards Ebola Zaire, which has been the more common Ebola strain. Bundibugyo is not easily diagnosed. It requires a reference laboratory to be able to do it, or a more sophisticated laboratory than just the cartridges that have, they're these kind of small machines called gene experts that you can do rapid PCR. And so the reliance on those PCR machines, which are fantastic in most cases, in this situation didn't give us good results. So people didn't realize that it was Ebola even when tests were being done. So that's why we're running way behind it. And we've got to get in front of it. We are in big trouble with this outbreak. It must be pulled under control as quickly as possible, and so all hands on deck.
Okay, it's a really worrying situation, isn't it? Rimoin, thank you for your expertise and insights on this.
Thanks for having me.